The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. We're glad that you've joined us today. I'm your host, Don McIntosh, and today we're going to be talking about a very important subject. In fact, we're going to be talking about the #1 killer in Western countries, and this is cardiovascular disease. Not just heart attacks, which we normally think of, but also strokes, everything that has to do with the cardiovascular system. And joining us to talk about this important topic is Dr. Timothy Lawton. He's a physician from Wichita, Kansas, and he practices what's called lifestyle medicine. This is the best of two worlds, medicine and also looking at lifestyle. That is what you can do in the style of life that you lead. Thanks so much for joining us, Dr. Lawton.
Thanks, Don.
Now, you have an actual center. Tell us a little bit about what you do day to day.
When we see a patient who's got something like heart disease, we look at all the different factors that are lifestyle related. We look at lifestyle factors that impact their blood pressure, that impact their cholesterol. If they smoke, we work with them to help them stop smoking. And we set up specific achievable goals that they can work on at home day by day.
Mm-hmm. And the name of your lifestyle is Vitae, which means life, and then you call it Vitae Lifestyle Medical Center. So it's bringing those two together. You follow them medically, work with their physician.
Medical plus lifestyle.
Right.
Yeah, all together.
I think this is certainly the wave of the future. It should have been the wave of the past as well. Well, let's talk then about cardiovascular disease. You were careful to say to me before we began that it's #1. It's considered still #1 if you add heart disease and stroke together.
Right. For years, simply heart disease has been the #1 killer, but within the last year, cancer has overtaken heart disease as the #1 cause of death. But still, if you combine heart attack and stroke, that accounts for almost 1 million deaths in the U.S. per year, and accounts for a quarter of all of our healthcare expenditures, which we know is up in the trillions of dollars.
So $350 billion or something on cardiovascular.
Just on diseases of the heart and brain.
Now, another thing you mentioned to me was that many times when we talk about cardiovascular disease, we often hear about cholesterol, and we're not going to really talk about that too much today. You want to talk about something else?
We'll talk about the three main risk factors, but today we'll focus mostly on blood pressure because it's such an important risk factor. I would say the #1 risk factor is really smoking. You've got to quit smoking. Best tip yet is not start. You know you can't get addicted to something you never have tried.
Right.
And with the cholesterol, it's becoming a more and more complicated issue the more we learn about it. It's not just high cholesterol, but what kind of cholesterol do you have? And
homocysteine and all those other
things. There's a lot of other things.
But blood pressure is pretty clear. If it's high, it's going to be a problem.
In fact, Don, I think this is really astounding. Your risk for heart attack or stroke doubles with every 20 points your blood pressure goes up. Starting at 115, and every point above that, or every 20 points, you double your risk.
So we have a definition of high blood pressure.
Yeah.
What's it say here?
Well, normal blood pressure is less than 120/80. We have those two numbers. The top number is called the systolic pressure. That's the squeezing pressure. And the other number is called diastolic blood pressure. That's your relaxing pressure when the heart's refilling to squeeze the next beat. So anyway, we've got the normal, which is less than 120/80. We've got this new zone called or newly defined zone called prehypertension. That's if the top number is 120 to 139 and the bottom number is 80 to 89. And then high blood pressure starts when either the top number gets to 140 or the bottom number gets to 90. So that prehypertension is a wake-up call. It says you got to do something before your blood pressure gets any higher or you're going to be in trouble.
And I imagine you see a lot of patients with this.
You know, huge numbers, huge numbers. The numbers nationally show that by the time you're 50, 44% of us have high blood pressure. By the time you're in your 60s, it's 54%, and by the time you're 70 and above, it's about 2/3 of all Americans have high blood pressure.
Significant problem.
Huge problem.
And in your practice, you've seen patients. What do you say to them?
Well, we have a long list of things that they can do to start improving their blood pressure. And I think that the first thing that we'll talk about is weight loss.
Okay.
Because losing even 10 or 15 pounds can be the difference between having high blood pressure and having normal blood pressure. And it's real exciting. People, again and again, we've seen them lose not 100 pounds, but just a moderate amount of weight can either help them get off medications or be better controlled.
Someone told me that for every pound of extra weight you carry, that's like 200 miles of blood vessels you have to have. Is that true?
Well,
or
I think
false?
it's maybe more like 6 miles of blood vessels, but yeah, there's a lot more work the heart has to do.
So when you lose weight, do you lose those blood vessels? I always wondered that. I mean, I don't mean to put you on the spot, or is that just a way of describing what happens with the extra weight?
As far as losing extra weight, there's something called visceral adipose tissue. Visceral fat means the fat that's inside your belly, not the stuff that's hanging off the arms and on the hips. That stuff isn't as dangerous for the heart. It's the fat that sits around your organs inside. And when you lose those 10, 15, 20 pounds, that's some of the first fat that starts to come off. You might not notice a whole lot of difference except maybe in your waist size. And that's the fat that's most dangerous for the heart, is the fat around the middle.
And why is that so dangerous, that stuff around the organs?
Well, it affects the blood pressure, but it also affects the cholesterol, and it affects how our bodies handle blood sugar. So it puts it at higher risk for diabetes as well.
So is there a special lifestyle, or I hate to say diet, because you want it to be a lifestyle that people go on? Is there something you tell people to help them start losing weight in terms of their diet?
Well, the most studied diet for blood pressure has been something called the DASH diet, D-A-S-H, and that stands for Dietary Approach to Stop Hypertension. And this has been looked at for over 10 years, but some of the main components are whole grains as opposed to refined grains. And just to spend a second on the whole grains, people who eat 3 or more servings of whole grains a day as opposed to less than 1 reduce their risk of heart attack by almost half, just by that one change alone.
So white rice, no. Brown rice, yes.
100% whole grain bread. It's got to say 100%, or it's not completely whole grain.
Whole grains, okay.
I'll talk about those other things, and then we'll get back to some more details. But fruits and vegetables, at least 5 servings a day are recommended. Low-fat or non-fat dairy, keep it to less than 2 or less servings. Nuts, seeds, and beans, most days of the week are recommended, if not all days. Limiting consumption of animal products like meat, fish, and poultry to no more than 2 servings per day, and also limiting saturated fat.
This is the DASH diet.
This is the DASH diet.
To avoid...
Dietary approach to stop hypertension.
Dietary approach to stop hypertension. Okay.
What they've shown is people who are on this diet, on average, lower their systolic blood pressure by 11 points. That is a stronger factor than exercising, but that's important. You can lower it a couple of points, but this is the most important factor.
11 points it'll lower it if you go on.
So 150 down to 139, for example.
All right. So and that's you said that for every, what was it, every 20 points the blood pressure goes up, that doubles the risk of heart attack or heart disease or cardiovascular disease.
Right. So when you go from 115 to 135, that's doubling that risk. By the time you go to 155, it's up fourfold. By the time you go up to 175, you've increased your risk by eightfold over someone with normal blood pressure.
Now, you know, when I first meet, or many times when people first meet a physician or something, they have this white coat phenomena where their blood pressure goes up. How do you get around that in your clinic? Do you wear a different color coat, or what do you do? How do you make this diagnosis?
You know, I don't think it matters what color coat I wear. Just the fact, you know, people are often a little apprehensive going to the doctor's office. People get anxious sometimes even about having their blood pressure checked. So we do something called ambulatory blood pressure monitoring. Ambulatory means at home. People can get a blood pressure automatic unit to check their blood pressure at home, write these numbers down, and then compare to what we find in the office.
Okay, so that gets around the fact that you could scare them. Anything else that you want to tell us about in terms of blood pressure?
Well, the DASH diet was formulated based on what foods are rich in certain vitamins and minerals that are good for the blood pressure. And one of the things that has been known for 30, 40 years has been the importance of cutting back on the salt in the diet. So we want people to eat a low sodium diet, and we have a graphic on that. But we also want them to eat a diet that's high in potassium. And the foods that are in the DASH diet are high potassium foods.
But low in sodium.
But low in sodium.
So the graphic on sodium, we're going to look at that and help us see what this means. So what does it say?
Limiting sodium, originally it was hoped that people could limit their sodium to 2,400 milligrams a day. This is salt. But it was found that if you can limit your sodium to 1,500 milligrams a day, that is as effective as taking one prescription drug for your blood pressure. Now, I tell my patients, you really want to do it, you gotta consider the sodium as a bank account. You've got 1,500 sodium bucks to spend each day. Use them wisely. If you get that chicken noodle soup, it might be 900 milligrams of sodium. You've blown a lot of bucks on that. The second thing on the graphic was the importance of potassium. Even if you cut down on the salt or sodium, if you don't eat foods that are rich in potassium, you're not going to have as beneficial an effect on your blood pressure. So it's really the combination of lowering sodium and increasing potassium.
Now, are some people more salt sensitive than others?
It's thought that certain people are more salt sensitive, but really it comes down to how much potassium you're getting. Potassium alone can decrease the blood pressure.
Do they have like salt shakers with potassium in them?
You can do that, but the best way really to do that is through the foods. And people usually think about bananas, but bananas are actually the number 20 on my list as far as high potassium foods.
What's number 1?
Sunflower seeds.
Okay, that's good, from Kansas. You know, you're from Wichita, right?
Almonds, raisins, parsley, nuts, spinach, broccoli. I mean, these are all excellent high potassium foods. Keep eating your bananas.
And tomatoes.
Absolutely.
Yeah, all good. So high potassium, low sodium, and then the other thing is to lose weight. That's what we've learned so far. We're talking with Dr. Timothy Lawton. We're talking about cardiovascular disease, and we've noticed that one of the most important things to consider is blood pressure and how to make that come down to a normal level. We're going to talk more about what to do with cardiovascular disease when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who are able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, And in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We're talking with Dr. Timothy Lawton. We're talking about cardiovascular diseases, and Dr. Lawton has told us that cardiovascular disease is still number one in Western countries, especially America. When you look at heart disease and stroke and add those together, many times we talk about cholesterol and smoking, and these things are important to avoid, but Dr. Lawton is really focusing our attention today on hypertension. And Dr. Lawton, you see a lot of this in your lifestyle medicine center there in Wichita, Kansas. A lot of people come in with this problem. And you've seen that really, what was it you said, that really hypertension is very important to look at.
It's one of the most significant risk factors when we look at preventing heart disease and stroke.
So if you told us we need to lose weight, you've given us some ideas on how to do that, and you've told us that our diet, if we follow what you called the DASH diet, it can actually decrease our blood pressure by 11%. Is that what you said?
11 points on average.
11 points.
You know, the exciting thing about the DASH diet is they have actually gone above and beyond the DASH diet to incorporate some new additional recommendations. The original DASH diet contained a limited amount of dairy and meat. The new version, actually just released within the last couple weeks, shows that if you substitute animal protein for plant protein, you have an additional reduction in your blood pressure.
Of how many points?
A couple more points, so in addition to the 11. And what they did in this study was they cut half of the animal protein and brought in plant protein, such as beans, vegetables, and nuts.
Okay, and then the third thing you mentioned was limiting the sodium, but not just limiting sodium, putting potassium in its place.
Potassium is the antidote, the anti-salt, so to speak. Salt makes the pressure go up, and potassium makes the pressure go down.
And these are all the foods that, plant-based foods. Many of them are very high in potassium. You think of bananas, always sunflower seeds.
Seeds, nuts, beans, green leafy vegetables, all these things. Squash, yams, very high in the potassium.
Now, you mentioned magnesium to me.
Magnesium is another important factor. There is something to keep in mind. Certain minerals balance each other in the body. Salt or sodium is balanced with potassium. That's why one works against the other. Calcium and magnesium work
in tandem.
Work opposite each other as far as blood pressure. Calcium and magnesium are required for the squeezing of the muscle cells in our bodies. One is required for the squeezing and one is required for the relaxation. So for someone to have an abnormal level of either calcium or magnesium, you'll affect the heart, but also keep in mind each of the blood vessels is surrounded by a structure of muscles that help us, let's say we would cut ourselves and lose a significant amount of blood. Well, our blood vessels would squeeze down to conserve and increase the pressure in what we have left. So those muscles are very important in each of our blood vessels. People who have high blood pressure are sometimes prescribed a calcium channel blocker, something to block the calcium. Well, I just said calcium and magnesium work opposite each other. So instead of blocking the calcium, you can increase the magnesium in your diet or through supplements, preferably through diet. And that can make a difference with bringing down the blood pressure.
So what are some foods that are high in magnesium? I mean, what are the things that I should go out and buy?
Well, number one on the list is wheat germ.
Wheat germ?
Wheat germ is...
My mom used to always put it on the top of my cereal.
Well, there you go. It's good for a lot of different things. But when we eat the white bread, the refined white flour, which makes up the majority of the wheat we consume, it's got the germ taken away. So we lose that magnesium that was in there.
Other sources?
Nuts, like almonds and cashews, are especially high in magnesium. Buckwheat, Brazil nuts, peanuts, walnuts, and rye are also good sources
So really what you're saying, when we're thinking about hypertension, instead of having to remember all these lists, which are great lists, would be just to eat foods as grown in liberal, unadulterated, unprocessed type quantities.
That makes a big difference.
Yeah. Okay, what's next on our list?
Well, the next thing on the list is to quit smoking.
Okay.
Because that's a very important factor. And after that, consuming healthy fats. I think a brief talk about the kinds of fats is very important. There's a certain family of fats that are called omega-3 fats. These are found in things like flax oil or flax seeds, canola oil, walnuts, as well as fish and fish oil.
Okay.
These actually help to bring down blood pressure. They also help to thin the blood and reduce the risk of blood clots.
So have the healthy fats, and then on our graphic it said avoid trans fats. What are trans fats?
If you see the word partially hydrogenated on the label, that's another word for trans fat. Partial hydrogenation is the process of taking a liquid fat and making it a solid at room temperature.
So like margarine?
Margarine, French fries,
all these different things.
Shortening, and food, most of the commercial baked goods, the pies, the crackers, the cookies, these are made with trans fat or hydrogenated fat.
So trans fats, how do they increase the blood pressure?
They impact, well, the cell membranes. These fats, actually, the membranes of every cell in our body is made up of fats, and these actually get into our cell membranes. Are an unnatural kind of fat that get incorporated into our bodies. So they impact how, like I said, the calcium and the magnesium and these minerals interact with the cells.
I understand they stay in the body a long time, these trans fats.
They're incorporated into every cell in our body until those cells die and are turned over. They're there.
And I see that they're trying to respond to the research that you're presenting in the stores. I see a lot of things now that say no trans fats, and those are the things to look at. Is that what you're suggesting?
That's an interesting factor. The Institute of Medicine says there is no safe level of trans fat. They would recommend 0. Mm-hmm. They said, well, let's be practical now. Maybe you should keep it under 2 grams a day. Well, the trans fat, there's a little bit of labeling confusion that's gone on. Right now, you might pick up a box of crackers and it might say 0 grams of trans fat. But you look under the ingredients, it'll say bleached wheat flour, partially hydrogenated soybean oil or some kind of oil. Well, how can they claim 0 grams if it's got something partially hydrogenated? The labeling rule says it has to be under 0.5 grams, and they can write 0. So if it's 0.49 grams, you can still write 0 on the label.
Interesting. So you got to look very close at the label.
So you got to read the ingredients.
What about exercise?
That can make quite a few points improvement in one's blood pressure. The amount of exercise that has been shown is a moderate amount of activity, like a brisk walk, 30 to 45 minutes, at least 3 or 4 days out of the week. If you can do more, better. But this is the minimum that's needed to improve blood pressure.
That brings it down another couple points.
Another couple points. So all these things, 11 here, 5 there, a couple here will make the difference.
Okay. Alcohol?
Alcohol is not recommended for blood pressure. It seems, and I'll tell you a story about that. I had a patient who was only in his 20s, and he had high blood pressure. He was already taking, I think, 2 medications for his blood pressure. So I just asked him about some of his habits. He was overweight, but he drank 5 drinks or so a night just to kind of settle down. That was his habit in the evening. In a couple weeks, we were able to cut out the alcohol. And, alcohol is basically an empty calorie source. So by cutting out the alcohol, he lost about 10 pounds almost immediately. His blood pressure went from 160 down to 140 in a matter of weeks.
Just by cutting out the alcohol.
And losing a couple of pounds. But I think the alcohol directly raises the blood pressure, so cutting that out can make a big difference.
Stress management. What did you do for this guy? He usually used to reduce his stress through drinking alcohol. Well, what what did you recommend to him? What do you recommend? Or is there any association between stress and blood pressure?
Huge research going on right there. They kind of call that the mind-body factor. There was a study out of Harvard with men with hypertension, and they found that using stress reduction techniques, things like prayer, meditation, people were able to, 80% were able to reduce their need for medication.
Is that right?
Simply on
80%.
Stress management.
That's very high.
That is, yeah, very, very impressive.
And so finding something with, within your religious tradition, looking to God, things, sometimes people in the religious tradition, that increases stress for them, but finding what reduces it for you.
And I like to talk about with patients not just the concept of relaxation, but this concept of enjoyment. Even a smile or a laugh can boost the immune system and help to reduce blood pressure.
You wanted to say something when we talked about healthy versus non-healthy fats about nuts.
We had said earlier at the beginning of the program that people who consume 3 servings a week of whole grains cut their risk of heart attack by almost half. Well, the same is true for people who consume 5 servings a week of nuts. They cut their risk of heart attack almost by half. Add that to a brisk walk, 30 minutes, 3 times a week, you cut your risk of heart attack almost in half. So just doing those 3 things, nuts, whole grains, and a little bit more physical activity.
Oh, well, how do nuts do that? How do they decrease your risk?
Well, we just looked. They're very high in
magnesium
and very high in potassium, and they're high, at least some of them, in the good fats. In fact, there's 2 kinds of good fats. We mentioned the omega-3s, but there's another family called monounsaturated fats. And nuts are very high in these, as is olive oil.
So let's just review. We say lose weight.
If you need to.
Go on the DASH diet.
Right.
DASH minus the meat and minus the other things is even better.
Even better if you substitute plant protein.
Limits sodium, but replace it with potassium.
Correct.
Adequate magnesium. Moderate exercise, which means 30 to 45 minutes, at least 3 to 4 days a week.
Yes.
Limit alcohol.
Right.
Or cut it out. Stress management. Relax. Quit smoking, and then have the healthy fats. Avoid trans fats. Thank you so much for joining us and taking time from your busy schedule there in Wichita at Vitae.
Thank you, Don.
And thank you for joining us today on Health for a Lifetime. We hope that today's program helps you avoid hypertension and all the problems that go with it, and that as a result you have health that lasts for a lifetime.